Not every fading name, missed appointment, or moment of confusion begins with disease. Sometimes it begins with a pill bottle, a tablet taken for sleep, a capsule for urgency, a prescription meant to calm, ease, settle, or relieve. Something so common, so routine, that nobody thinks to question it until memory starts slipping in ways that no longer feel small. A familiar road suddenly looks strange. A sentence disappears halfway through. A person who was always sharp begins to lose the thread, and the whole family reaches for the same explanation first: age. But age is not always the first cause. And when medication is part of the picture, missing that fact can cost someone months, sometimes years, of clarity they may not have needed to lose. After a certain age, the brain becomes less forgiving. Drugs stay in the body longer. Side effects hit harder. One medicine can interact with another. And some of the medications older adults are most commonly given are the very ones most likely to cloud attention, slow recall, worsen confusion, or mimic the earliest stages of dementia. That does not mean these drugs are evil. It does not mean no one should ever take them, and it absolutely does not mean you should stop them on your own. It means something simpler and more important. If memory has changed, the medicine cabinet deserves to be questioned before the brain gets blamed. I'm going to walk you through 9 medications and medication groups that may affect memory in older adults, counting down from the ones people dismiss most easily to the one that may be doing the most damage without anyone realizing it. Watch carefully for number 1, because it is not a single drug at all. It is the hidden pattern that turns several small risks into one much larger one. And before we start, tell me in the comments your age and how many medications you take each day, prescription and over-the-counter. For older adults, medication overload is often where this story begins. Number 9. Diphenhydramine and first-generation antihistamines research basis, AGS Beers Criteria, 2023, Harvard Health, Mayo Clinic. The list starts with a drug so familiar that people rarely even think of it as a brain risk. Diphenhydramine. Most people know it as Benadryl. Others meet it under different labels, usually in allergy tablets, nighttime cold medicine, or anything stamped with the promise of sleep. It is easy to buy, easy to take, and easy to trust. That is exactly why it causes so much trouble. Diphenhydramine belongs to a group of drugs called anticholinergics. That sounds technical, but the idea is simple. These drugs block acetylcholine, one of the chemical messengers the brain uses for memory, learning, and attention. Mayo Clinic notes that acetylcholine helps with memory, learning, and concentration, and when it is blocked, older adults are especially vulnerable to confusion and other side effects. Mayo Clinic. That matters more with age, because the older brain is already working with less reserve. What a younger person shakes off as grogginess can land much harder in a 70-year-old. The result may not look dramatic at first. It can feel like brain fog, slower recall, losing the thread in conversation, walking into a room and forgetting why. But those small daily slips are often the very details families notice long before anyone says the word dementia. The American Geriatric Society's 2023 Beers Criteria, one of the most important medication safety guides for older adults, says first-generation antihistamines, such as diphenhydramine, are highly anticholinergic and should generally be avoided in older adults because of confusion and other cognitive harms. The same guidance also warns that cumulative exposure to anticholinergic drugs is associated with increased risk of delirium and dementia. AGS Beers Criteria 2023. And then there is the long-term picture. Harvard Health summarized the well-known Adult Changes in Thought study, which followed nearly 3,500 adults aged 65 and older. It found that taking strong anticholinergic medications for the equivalent of 3 years or more was associated with a 54% higher dementia risk compared with short-term use. That study does not prove causation, but it is one of the clearest warnings that this is not a harmless nightly habit. Harvard Health. This is what makes diphenhydramine so deceptive. It does not look dangerous. It looks ordinary. It sits on the shelf beside cough drops and tissues. No one expects the pink sleep pill to be nudging the brain in the wrong direction, night after night. If you take it occasionally for a severe allergic reaction, that is one thing. If it has become part of your evening routine, that is a different story. Many older adults can talk with their doctor about newer antihistamines, non-drug sleep strategies, or safer options that do not carry the same anticholinergic burden. Do not change anything on your own. But do not assume over-the-counter means free of consequence, because number 8 is prescribed for a problem people hate talking about, and the medication used to treat it may affect the exact same memory system. Number 8. Oxybutynin and bladder antimuscarinic drugs. Research basis. Medline Plus. Oxybutynin, AGS, Beers Criteria, 2023. Cleveland Clinic, Beers Criteria. Urgency changes lives in quiet ways. People plan car rides around bathrooms. They avoid long errands. They wake up anxious at night. They stop going out as much. So when a doctor offers a pill that calms the bladder, the relief can feel immediate and deeply personal. One of the best-known drugs in that category is oxybutynin. Here's the problem. Oxybutynin works by blocking muscarinic receptors, which means it also acts as an anticholinergic. In plain English, it calms the bladder by interfering with the same acetylcholine system the brain relies on for memory and mental sharpness. That trade-off is not theoretical. Medline Plus specifically says older adults generally should not usually take oxybutynin tablets or syrup because they are not as safe and may not be as effective as other options for the same condition. The same page lists confusion among the side effects and notes that overdose symptoms can include memory loss, confusion, and hallucinations. Medline Plus. That should get your attention. Because when someone starts a bladder medicine and months later begins forgetting appointments, misplacing essentials, or struggling to follow conversation, the two events are rarely connected by the family. The urinary problem feels unrelated to the brain, but in older adults, the boundary is not that clean. The Beers Criteria places strong caution on anticholinergic drugs in older adults precisely because these cognitive side effects are common enough, serious enough, and often overlooked long enough to matter. This is not just about dry mouth or constipation. It is about what happens when a drug intended for comfort starts dulling the system that lets a person remain independent. A GS Beers Criteria, 2023. And the tragedy is that many older adults assume the fog means their mind is failing, when what may actually be failing is the fit between the drug and the aging brain. That is why this one deserves a careful medication review, not silent endurance. For some people, newer options, dose adjustments, bladder training, pelvic floor therapy, or different drug classes may reduce the burden on the brain, but that decision belongs with the prescribing clinician, not with a sudden stop at home. Number 7 is older, broader, and in some ways even more misleading because it is prescribed not only for mood, but for pain, sleep, and nerve symptoms too. Number 7. Amitriptyline and other strong anticholinergic antidepressants. Research basis. Medline Plus. Amitriptyline. AGS Beers Criteria. 2023 Cambridge Systematic Review. Some medications remain popular not because they are gentle, but because they are versatile. Amitriptyline is one of them. It is an older tricyclic antidepressant, but in real life, it is often used for much more than depression. People are given it for nerve pain, sleep trouble, chronic headaches, and lingering body discomfort. That wide usefulness makes it easy to overlook how heavy its side effect burden can be in older adults. The Beers Criteria is direct here. Amitriptyline and several other older antidepressants are listed as highly anticholinergic, sedating, and likely to cause orthostatic hypotension. In other words, they can cloud the mind, make people sleepy, and increase instability all at once. A GS Beers Criteria. 2023 Medline Plus is also plain. Older adults generally should not usually take amitriptyline because it is not as safe or effective as other medicines that can treat the same condition. Medline Plus. What does that look like in daily life? Often not like a crisis. Often it looks like someone becoming less mentally crisp, slower mornings, more daytime fatigue, more missed details, less confidence while speaking, a kind of soft dimming that can be explained away for a long time because nothing about it seems dramatic enough to raise an alarm. But the cognitive risk is not just a guess. A 2024 systematic review in International Psychogeriatrics found that antidepressants with anticholinergic properties were among the psychotropic drugs most consistently associated with cognitive decline in older adults, especially in people who were cognitively healthy when treatment began. The review also notes an important caveat. Most of the evidence is observational, which means reverse causality cannot be fully ruled out. Still, the signal is strong enough that these medications deserve real caution. Cambridge Systematic Review. That is what makes amitriptyline different from a simple sleeping pill. It can settle into a person's routine and stay there for years. A low dose becomes a nightly habit. The brain adapts, the family adapts, and the growing slowness gets filed under age rather than medication. If this is a drug you or someone close to you takes, it is worth asking a doctor a very specific question. Is this still the best option for the problem it was prescribed to solve? In many cases, there may be alternatives that are easier on the brain. Because number 6 is a modern antidepressant many people assume must be safer than the older ones. Yet one hidden property puts it in a very different category from most of its cousins. Number 6, paroxetine research basis, a G.S. Beers criteria. 2023, Cambridge Systematic Review, Medline Plus, paroxetine. Most people hear the word SSRI and assume the story ends there. Modern, common, manageable. And for many that assumption is closer to the truth. But paroxetine has one feature that sets it apart in older adults. It has stronger anticholinergic activity than most other drugs in its class. That matters because the memory problem we have been tracing through this list keeps returning to the same chemical system, acetylcholine. When that system is repeatedly interrupted, the brain pays for it in attention, short-term recall, and mental clarity. The 2023 Beers criteria places paroxetine alongside strong anticholinergic antidepressants that should generally be avoided in older adults. That is not a minor warning. It is a signal that this drug behaves differently from the SSRI label many people mentally place over it. A G.S. Beers criteria 2023. The 2024 Systematic Review on Psychotropic Medications and Cognition highlighted the same concern, noting that cognitive decline associated with tricyclic antidepressants and paroxetine can be explained in part by their anticholinergic properties. That does not mean every older adult on paroxetine will decline. It means that if memory worsens while taking it, the medication belongs near the top of the list of possibilities to review. Cambridge Systematic Review. This is one of the crueler patterns in geriatric medicine. A drug prescribed to stabilize mood can, in the wrong patient, start to erode the very clarity that helps that person feel like themselves. Words take longer to find. Focus becomes more fragile. The person may not feel wildly confused. They just do not feel as mentally clean as they used to. And because depression itself can impair memory, it becomes hard to separate illness from treatment. That is why older adults should never make changes abruptly. The answer is not to quit the medication. The answer is to review whether it is the best fit, whether dose matters, and whether another antidepressant without the same anticholinergic burden might serve the same purpose more safely. If number 6 hides behind the reputation of a drug class, number 5 hides behind relief itself, because few medications feel more effective in the moment than the ones we are about to talk about. Number 5, benzodiazepines research basis, a G.S. Beers criteria, 2023, Cambridge Systematic Review, Medline Plus, alprazolam. Anxiety can feel unbearable. So can panic. So can the nights when sleep simply does not come. That is why benzodiazepines can seem like miracle drugs at first. Alprazolam, lorazepam, diazepam, clonazepam, they quiet the system fast. The mind that was racing slows down, the body unclenches, the person finally rests. But quick relief is not the same thing as a safe long-term fit for an older brain. The Beers criteria does not hedge on this. It says that in general, all benzodiazepines increase the risk of cognitive impairment, delirium, falls, fractures, and motor vehicle crashes in older adults. It also points out that older adults are more sensitive to these drugs and clear them more slowly, especially long-acting ones. A G.S. Beers criteria, 2023. And the day-to-day cognitive effects are often exactly the ones families notice first. More forgetfulness, slower thinking, flattened attention, reduced mental flexibility. Medline Plus warns that alprazolam can be associated with memory problems and difficulty concentrating, and notes that it may not be recommended in people 65 and older because safer options may exist. Medline Plus. Now here is where accuracy matters. The dementia question with benzodiazepines is more complicated than many headlines make it seem. Some studies and reviews suggest higher risk, while others argue the association may be explained partly by reverse causality, meaning early symptoms of dementia may lead to benzodiazepine prescribing rather than the other way around. The 2024 Systematic Review still found cumulative benzodiazepine use associated with cognitive decline in older adults, but it also emphasized that most of the evidence is observational. Cambridge Systematic Review. And honestly, for families living through it, the causality debate is not the first question. The first question is much more immediate. Did this medication make thinking worse? Often, the answer is yes. The most dangerous part is how indispensable these drugs can feel once the body adjusts to them. Coming off them suddenly can be dangerous. Anxiety rebounds, sleep breaks apart. Withdrawal can become serious or even life-threatening, so the correct response is never abrupt stopping. It is a slow, medically supervised review and taper if appropriate. If you or a loved one has been on a benzodiazepine for months or years, do not panic. But do not ignore creeping mental fog either. Because number 4 is the nighttime drug many people are told is gentler than the older sedatives, even though older adults often experience many of the same cognitive consequences. Number 4. Z drugs like zolpidem research basis. AGS Beers Criteria 2023. Medline Plus, zolpidem. Insomnia can make people desperate. After enough sleepless nights, almost any promise of rest sounds reasonable. That is how drugs like zolpidem, zaloplan, and azapiclone became so common. They were marketed and often perceived as cleaner, more modern sleep aids. Not quite benzodiazepines, not quite as risky. For older adults, that distinction can be misleading. The Beers criteria says these so-called Z drugs have adverse events similar to benzodiazepines in older adults, including delirium, falls, fractures, increased emergency visits, and other harms, while offering only minimal improvement in sleep latency and duration. A GS Beers criteria 2023 Medline Plus is equally clear about zolpidem. If a person gets up too soon after taking it, they may experience problems with memory, alertness, or coordination. It can also cause decreased mental alertness, prolonged reaction time, and next-day impairment. Most strikingly, Medline Plus says older adults generally should not usually take zolpidem because it is not as safe or effective as other treatment options for the same condition. Medline Plus. Think about what that means in real life. An older adult takes a sleep pill because they are exhausted. The next day they are slower, slightly off balance, not fully clear. They forget part of a conversation. They feel groggy in the morning and shrug it off because they think that is the price of sleeping. But if that pattern repeats for weeks or months, the line between medication effect and my memory is getting worse starts to blur. That blur is dangerous because sleep medication can make someone appear cognitively older than they are. Families may notice the change first at breakfast, during phone calls, or when the person seems less steady in a way that feels subtle but new. Nobody suspects the bedtime pill because the person is technically taking it correctly. This is why the conversation around sleep in older adults has to be smarter than simply, did it knock you out? The better question is, what did it cost the next day? And if the brain fog is being dismissed because the medicine feels routine, number 3 is even more serious. These are drugs that can change behavior, reduce agitation, and quiet difficult symptoms. But in the wrong setting, they can also accelerate decline in a way families never forget.
Number 3. Antipsychotic medications research basis. AGS Beers Criteria 2023 Medline Quetiapine Cambridge Systematic Review. This is where the list becomes harder to hear. Antipsychotics such as quetiapine, risperidone, olanzapine, and haloperidol were developed for serious psychiatric conditions, but in older adults, especially those with dementia or agitation, they are sometimes used to manage behaviors that are distressing, exhausting, or difficult to control. And sometimes they are used when what the person actually needs is pain treatment, quieter surroundings, better sleep timing, less overstimulation, or a different caregiving approach. The Beers criteria warns that antipsychotics are associated with increased risk of stroke and a greater rate of cognitive decline and mortality in persons with dementia. It recommends avoiding them for behavioral problems of dementia or delirium unless non-drug approaches have failed or there is risk of substantial harm. AGS Beers Criteria 2023. Medline gives an equally stark warning for quetiapine. Older adults with dementia who are treated with antipsychotic medications may have an increased risk of death, along with increased risk of stroke or mini-stroke, and the drug is not FDA approved for behavior problems in older adults with dementia. Medline that alone should end the idea that these are casual calming medicines, and the cognitive effect is not small. The 2024 Systematic Review on Psychotropic Medications found that antipsychotic use was associated with significant cognitive decline in older adults, with several studies reporting much faster decline than in comparison groups. Cambridge Systematic Review families describe this in painful language. He was still here before the medication. She became flat. He stopped looking like himself. She seemed quiet but gone. That kind of loss is not always the disease alone. Sometimes it is the price of suppressing a brain that is already vulnerable. Now, to be fair, there are situations where these drugs are necessary. Severe psychosis, dangerous aggression, extreme distress. No responsible discussion should deny that. But necessity is not the same as convenience, and older adults deserve the difference to be respected. If one of these medications was started, ask why. Ask what behaviors triggered it. Ask what non-drug approaches were tried first. Ask whether the dose is still necessary. Those are not confrontational questions. They are protective ones. Number 2 is different. It does not usually enter the story through psychiatry or sleep. It comes through pain, and pain relief can be so badly needed that people rarely notice how much thinking has changed until the dose has already become part of life. Number 2, opioid pain medications, especially the ones with strong sedation. Risk research basis. AGS Beers Criteria 2023, Cleveland Clinic. Beers Criteria pain shrinks the world. When it becomes chronic, it robs sleep, movement, patience, appetite, and joy. So when an opioid eases that pain, even a little, it can feel like the first real relief in months. That is why the conversation around these drugs has to be honest. For some older adults, they have a place, but the brain cost can be substantial. The Beers criteria specifically singles out meperidine as a poor choice in older adults because it may carry a higher risk of neurotoxicity, including delirium, than other opioids. More broadly, the criteria also advise avoiding opioids in older adults at high risk of delirium when possible because they can induce or worsen it. AGS. Beers Criteria 2023. Cleveland Clinic's summary of the Beers list puts it simply. Meperidine is associated with neurotoxicity and delirium. Cleveland Clinic. Delirium is not the same thing as dementia, but families often mistake one for the other when it happens in older age. The person becomes confused, sleepy, disorganized, forgetful, sometimes agitated, sometimes eerily withdrawn. And because pain, hospitalization, infection, poor sleep, and multiple medicines often happen together, it becomes very hard to see the opioid as one of the drivers. The older brain does not tolerate sedation the way younger bodies do. Add an opioid to a benzodiazepine, a sleep aid, or an anticholinergic drug, and the mental slowing can deepen fast. Attention fractures. Recall weakens. Balance worsens. A person may not just forget more, they may lose the ability to think in a clean, connected way. For stretches of time. That does not mean severe pain should be ignored to protect memory. It means the dose, duration, combinations, and specific drug choice matter enormously. It means families should notice changes in alertness, not just pain scores. It means more comfortable should never quietly become less present without somebody stopping to ask whether the trade is too expensive. And now we arrive at number 1. This is the one that hides in plain sight. It is the reason one person can tolerate a single risky medication for a while another falls apart on what looks like a completely ordinary regimen, because the greatest danger is often not one drug. It is the pile. Number 1, cumulative anticholinergic burden and medication stacking. Research basis. AGS Beers Criteria 2023, Harvard Health, Mayo Clinic, Cleveland Clinic. This is the part almost nobody is warned about clearly enough. An older adult may not be taking one dangerous drug. They may be taking 3 moderate ones, an allergy pill at night, a bladder medication in the morning, an older antidepressant for sleep or pain, maybe a sedative as well. Each drug alone looks explainable. Each prescription has a reason. Each one seems small enough not to matter. Together, they can become something the brain cannot easily withstand. The Beers criteria explicitly warns that cumulative exposure to anticholinergic drugs is associated with increased risk of falls, delirium, and dementia. That word cumulative is the whole story, not isolated, not occasional, added together. AGS Beers criteria 2023 Harvard Health also emphasizes this point, describing the anticholinergic cognitive burden concept and urging patients to review all prescription and non-prescription medicines because the total load matters. Harvard Health. And the reason this becomes so common is simple. Older adults take more medication than any other group. Cleveland Clinic notes that more than 90% of adults over 65 take at least one prescription medication, and more than 66% take more than 3 prescriptions a month. Once you add over-the-counter sleep aids, allergy, drugs, nighttime cold medicine, and as-needed pills, the real burden can be much higher than anyone realizes. Cleveland Clinic, that is how memory loss becomes invisible inside routine. No single doctor may see the whole list. One specialist treats the bladder, another treats mood, another manages pain. A person buys sleep medicine without mentioning it because it is just over the counter. Months later, the family is describing brain fog, slower recall, and spells of confusion that seem to come and go. And because the decline is patchy, people often say the most dangerous sentence in this entire subject. Maybe it's just normal aging. Sometimes it is not. Sometimes the brain is being chemically pushed from several directions at once. This is the most hopeful part of the entire list, because medication-related cognitive decline is one of the few causes of memory change that may improve when the burden is identified and reduced carefully. Not always, not completely, not overnight, but enough to matter. Enough that people sometimes regain sharpness they thought was gone for good. That is why the next step is not fear, it is review. Bring every prescription, every vitamin, every sleep aid, every allergy tablet, every stomach pill, every just-in-case medicine. Put the whole picture on the table with a doctor or pharmacist and ask one focused question: what on this list could be affecting memory? That one question can change the direction of a person's next year. And before you leave, I want to hear from you. Which of these medications surprised you most? Have you or someone close to you noticed brain fog, slower thinking, or forgetfulness after starting a new medicine? Tell me in the comments, because when one person speaks up, someone else often recognizes their own story for the first time. There is one last thing I want to leave you with. The aging brain is vulnerable, but it is not helpless. Confusion is not always destiny. Forgetfulness is not always disease. Sometimes the warning signs arrive disguised as treatment, and the most important breakthrough is not a new drug at all. It is finally recognizing what the old one has been doing, and that is why medication review may be one of the most underrated forms of brain protection in later life. In the next video, I want to show you something else families miss for far too long. The early physical warning signs that can appear before a health crisis becomes obvious. The body rarely keeps secrets forever. You just have to know where to look. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Never start, stop, or change any medication without speaking to your healthcare provider first.